We hope in the future all your discussion to be recorded in books and video that students can review and study when they need references about mothers' life and their children. Once more, thank you very much for your attention. Selamat menikmati konferensi yang keempat. See you next time. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
STIKes Mitra Husada Medan is committed to providing excellent service during this webinar to all participants and stakeholders involved. And in conclusion, I extend to warm welcome to the 4th Mitra Husada Medan International Conference 2024. Thank you very much. Thank you.
Must know this thing. So we have to make easy for the workers, how the health workers to support the patient level, and also we have to think how the patient will get cured without suffer much, and how they can get immediate help from the healthcare workers. And that should be mother and children focus as our discussion theme today. So we should focus how we can help and support the community by this human-centric approach.
From time to time. So these are the sustainable development goal. We have got 17 goals. Okay, I would be emphasizing on goal 3 and goal 5, good health and well-being and gender equality. Okay, collaboration to achieve the sustainable development goal. Malaysia actually together with other 192 world leaders adopted the 2030 agenda for sustainable development at the United Nations General Assembly in New York in September 2015.
Mother and children health is our important and major program. In strategy of the Ministry of Health based on the strategic plan for development and national building in lab. The maternal mortality radio in the lab People's Democratic Republic has improved from 579 in 2002 to 176 in 2020, a reduction of 78.7%. Although the national mortality radio has dropped, but it is still high.
The quality of life score using QLQC 30 toolkit as follows. The raw score is the average score of the question on the same problem. The functional score is equal 1 minus raw score minus 1 divided by 3, then multiple with 100. Symptom score equal raw score minus 1 divided by 3 and multiple 100. Financial problem score equal raw score minus 1 divided by 3 and multiple 100. Overall quality of life score equal raw score minus 1 divided by 6 and multiple 100.
Target 3.1, reduce maternal mortality. Okay, target 3.1 is aimed by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live birth. So this is our target. Target is reduce the maternal mortality ratio to less than 70. Yeah.
And the last one, I know that if we need, I know Timor-Leste is experienced for the increase for transformation for LLM source. So we need in Timor-Leste, we need health safety standard. We need for the we need creative for individual to our health, for me to competence, good health service. We need to creative for our student, how to become the successful for our national development in Indonesia.
Mobile health applications that are available for mothers that they can download for them to use for their pregnancy journey. So it's a lot. We also have remote or wearable devices. These remote wearable devices in conjunction with telemedicine to enable remote appointments and become common in capturing information on the vital signs of women in high-risk pregnancies and to monitor any hormonal changes in the real time.
The opportunities of overcoming stunting in digital era. The first, telemedicine, and the second, mobile application, and the third, access to nutrition. This is the stunting I get from UNICEF and World Health Organization 2023 that stunting in 2022 in children 5 years is 148.1 million. Or we can get the percentage 20.3%. Stunting is the devastating result of poor nutrition in utero and early childhood. Suffering from stunting may never attain their full possible height, and their brains may never develop to their full cognitive potential. This is a problem of malnutrition in children. We can see there is stunting and then wasting, overweight, and then also stunting and overweight, stunting and wasting. But for stunting and overweight, also stunting and wasting, we cannot find the data, just data from stunting, wasting, and overweight. We can see this is for Asia, stunting 52%, in Africa 43%, and then for wasting, Asia 70%, Africa 27%, and for overweight, Asia 48%, and Africa 28%.
According to 2018 UNICEF data, it was recording that 165 million children throughout the world experience stunted development. Data from North Sumatra discussed that in 2018, the number of children who experienced stunted development, especially in their social development, was recording at 73.07%. Indonesian Child Protection Commission received a report of 37,381 cases of child violence in the period 2011 to September 2019, which occurred at every level of education, around 2,773 cases. Commitment to recognition and protection of children's rights is guaranteed in the 1,945